Good afternoon. Welcome to the January 21st Jefferson County Board of Health meeting. Happy New Year to everyone. And I'm going to turn it over to our colleague Viria, who's going to do the language justice for us.
Thank you very much for having us here and for practicing language justice. My name is Vidia Sosa, and I am here with the Community Language Co-op, and we are here to help create a space where everyone can participate and engage in the language of their hearts or the language that they feel most comfortable in. We will use simultaneous interpretation to create this space. When I finish saying this in Spanish, we will turn on interpretation, and you will see a globe icon at the bottom of your screen that says interpretation. Please select your preferred language. Hola, muy buenas tardes. Muchas gracias por tenernos aquí por practicar la justicia del lenguaje. Mi nombre es Viria Sosa y estoy aquí con la Community Language Co-op y estamos aquí para ayudar a crear un espacio donde todos puedan participar e involucrarse en el idioma de su corazón o en el idioma en el que se sientan más cómodos. Usaremos la interpretación simultánea para crear este espacio. Cuando termine de decir esto, activaremos la interpretación y verá un icono de globo abajo en su pantalla que dice interpretación. Por favor, seleccione su idioma preferido. Thank you very much. Please go ahead and turn on interpretation. Muchas gracias. Vamos a comenzar con la interpretación.
Thank you so much for my globe icon. Let's see it, but
Yeah.
oh, there it is. I think you need to go into more. Thank you so much again. Lindsay, can you help us with a roll call?
Sure. Rochelle Woods,
Present.
Harriet Hall,
Present.
Sherry John,
Present.
Blaine Drager,
Present.
and for the record, Sarah Lampe is absent and a quorum has been established.
Great. Our first agenda item is the consent agenda. If everything looks okay to stay on that, I would entertain a motion to approve our consent agenda.
I would so move. Second.
Any concerns or discussion? All those in favor of approving the consent agenda, please say aye.
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 And Sarah, I think, has just joined us. Welcome, Sarah. Just got started, so. Next item is public comment. And Lindsay, I think we did have someone that wanted to make public comment to the board.
We do. His name is Bruce. And Bruce, you can go ahead and unmute.
Hi, Bruce Feustel from the Jefferson County Council on Aging. We're lucky to have Cynthia Farrar as one of our members, but we also, after hearing Dr. Sarah's story, we're very much convinced that we want to get a broader understanding of health concerns, particularly for seniors in Jefferson County. So thanks for inviting me. I'll stop it right there. I'm always glad to answer any questions.
Bruce, thank you for joining us and sharing. I think more and more collaborations is how we continue to do more and more work in our communities. So public health is concerned about the health of all of our community, all ages, but great to have partners with even specific band areas. So thank you for joining us. And I'm sure Dr. Story will continue to connect with you. And if there's other connections for the Board of Health, yeah, please share, and either through Dr. Story or with us directly. So.
And a shout out to Cynthia. Cynthia, it's nice to see you.
All right. Next item is our financial report. I think Salma is going to take that one.
Yes.
Hello, everyone. Can I get a thumbs up if you can see my screen and you can hear me okay?
It just
Okay.
popped up. It's just not in presenter mode and can hear you all right. Thank you.
Okay. Perfect. Go. Hello, everyone. For those of you who don't know me, my name is Salma, and I am the Budget and Finance Supervisor. And today I will be presenting the GCPH 2024 Financial Summary. Please note that these figures are not finalized, and we don't expect to finalize it until the end of March or once the audit is complete. Starting with our revenues, and as we expected, we are at 106% of our annual revenues. So far, we've collected $784,000 more, and that was expected due to the revenue replacement funds that were unbudgeted and were used to offset budgeted cost in 2024. Some other surplus revenues came directly from clinical services division. So a lot of credit goes to that, to Max and his team, specifically the medical billing team who helps streamline our medical billing process. So far, we've collected 131% of our annual budget of Medicaid fees, 143% of client fees, and almost tripled the annual budget of insurance. The other highlight also for clinical services is the additional services that the clinical provided as a result of the mobile clinic. Moving to our expenditures and focusing on the big pictures, we've collected to date, we've spent to date 100% of the annual budget. However, we are expecting to surpass our annual expenditures budget by approximately $326,000. And that is because we still have some pending expenditures, including the remaining budget of cost allocation, 3 pay period of payroll cost that needs to be moved from 2025 to 2024, as well as few other pending invoices. Moving to county transfer, although it appears that we have 777 remaining county transfer dollars, or 8%, please note that we are reserving 326 of that to offset those pending expenditures. Any remaining cost will be carried forward to 2025 to support our Emory project. Again, I wanted to highlight that the reason why we have these savings is because of the revenue replacement funds, and we were reserving these funds to help support us and put us in a successful position, hopefully this year. That's all I have, unless if you have any questions.
Thanks, Salma. I actually have one on that last statement you mentioned. So we don't need any additional commissioner or other county approvals to carry over the county transfer that wasn't spent?
We do. I believe Joe is currently working on a carry forward request.
Okay.
So hopefully they will okay that and we won't run into any issues with that.
Thank you. Board, any other questions for Salma? Awesome. I would entertain a motion to approve the financial report.
I would second that.
I need a first motion first.
I'll make the first motion.
Then I'll
Now
second
that it's
that.
already been seconded.
Thank you. You probably
Sorry.
could cut that down. I could probably just make these motions and then you can all second it, but better to have more board participation. But we have a motion second. Any further discussion? All those in favor, please say aye.
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 All right, unanimous. Thanks, Salma.
Thank you.
Next up, new business, Radon Action Month. Mr. Rada, are you presenting that?
I am not presenting that. I believe that we had Tracy Volkman planned, but due to a shift of location for meeting, I think she's sitting at the Faye Griffin meeting room.
Oh,
Yeah.
no.
Oh, shoot.
I'm not sure she's available. So I've asked, or Madison has actually volunteered to do the presentation and asked for your reading of the proclamation.
Yep. So we don't have a presentation today. I just wanted to say a few words, give a little bit of background. So first, I want to offer Tracy's apologies. She was unaware of the location movement. But I also want to start off by saying thank you to the members of the Board of Health for recognizing the importance of addressing radon exposure in our communities. by signing this proclamation. This proclamation does serve as a critical step in raising awareness about the dangers of radon. And through the support of the Colorado Department of Public Health and Environment State Indoor Radon Grant, also known as SURGE, our program is working diligently to reduce lung cancer deaths in Colorado by implementing comprehensive education, testing, and outreach efforts. And this does include equipping residents with radon test kits, guidance on testing, and actionable information on mitigation, as well as supporting the CDPHE Low Income Radon Mitigation Assistance Program. We are also this year focusing on outreach and education efforts to populations disproportionately impacted by working with our Environmental Justice Partnership to encourage radon testing and linking them with that low income radon mitigation assistance program. We are also proud to share that Wheat Ridge and Arvada have recently signed similar proclamations, further strengthening our collective commitment to protecting our communities from those dangers of radon. So your proclamation not only brings attention to these efforts, but also serves as a powerful call to action for our residents to test their homes and take the necessary steps to reduce radon exposure, which is a vital component of our outreach and education strategy. And we are grateful for your leadership in this public health initiative.
Thank you, Madison. I can read the proclamation now. So the Jefferson County Board of Health proclamation in support of National Radon Action Month in Jefferson County, Colorado. Whereas January is National Radon Action Month and all Jefferson County residents are strongly encouraged to test their homes for radon. And whereas radon is a naturally occurring invisible, odorless, radioactive gas that is the second leading cause of lung cancer in the United States, contributing to as many as 500 lung cancer deaths in Colorado each year. And whereas any home may have high levels of radon, even if neighboring homes do not, and elevated levels pose a serious health threat to residents. And whereas approximately 50% of Jefferson County homes have radon levels exceeding the EPA recommended action level of 4 picocuries per liter. And whereas radon testing is easy and inexpensive, and identified radon problems can be fixed. And whereas all Jefferson County residents are encouraged to protect their families from the serious health risks associated with radon by reducing any elevated radon levels found in their home, which can be effectively accomplished for the price of a typical home repair. Whereas Jefferson County Public Health, the Colorado Department of Public Health and Environment, the U.S. Environmental Protection Agency, and the American Lung Association are supporting efforts to encourage Americans to test their homes for radon, have elevated levels of radon reduced, and have new homes built with radon-resistant features. Therefore, be it resolved that the Jefferson County Board of Health hereby proclaims January 2025 as Radon Action Month in Jefferson County, Colorado. And we, in order to make that effective, we need the board to have a motion and support putting this proclamation in place.
I would move to support the proclamation from the Jefferson County Board of Health for the radon in the county.
I'll second.
We have a motion and second. All those in favor, please say aye.
Aye.
Aye. Thank you. All right, motion passed unanimously. Thank you, EH team. Hopefully all the board has also taken these actions. I know I have a mitigation system in my house because I am one of those 50% that have elevated, or had, I should say, elevated picocuries. So yes, thank you for continuing that awareness, because I still don't think people all are aware of that.
Thank you.
Looks like Harriet has a question.
Yeah, I have a question about whether the other municipalities have been approached and will also be hopefully signing on to the proclamation and not just Arvada and Wheat Ridge.
Yes, we have 5 municipalities. Sorry, I was checking to make sure I was unmuted. We have 5 municipalities. Off the top of my head, I do not have those. I believe City of Golden, Wheat Ridge, Arvada, Lakewood. And I'm sorry, I cannot recall the 5th one at the moment.
Edgewater?
Edgewater, yes, sorry. Thank you. There you go.
Very good. Any other questions? Sherry?
I do have a question. Jim, I know that you all have been working on this for a very long time and done an excellent job on reaching out into the communities. Do you see a decline in the health risks? I mean, the amount of people that have been affected, the deaths that have happened in the county, with all the work that you all are doing and the awareness that you put out every single year, you're real good about that.
Yeah, so I don't have the specific numbers on that. I could definitely provide an update to the Board of Health with that specific information. I will say that unfortunately, there has been a decline in receiving test kits over last year. I do believe that is because there has been more test kits being released for free by the state. And they are available sooner. So I think that our population have gone to them, right? That I don't know that to be a fact, but I believe that to be true. So this year we did propose more of an outreach and education base to be able to have a larger, robust campaign within Jefferson County. So we are working with the health comms here to reach those demographics and get those individuals, if they do test high, and if they do qualify for the low income radon mitigation assistance program, to connect them with that. So we are using more of our grant as a resource to do that outreach, since the state of Colorado does have those resources available.
Yeah.
And sure, I
Thank
would
you.
add too that, efforts we've made in the past years around getting updated building codes in place for new single-family residence construction also have helped to reduce risk, because the newer building codes that the county has adopted, I believe Lakewood and Golden have adopted, perhaps other cities in the region or in the county have worked to reduce the amount of radon in homes, therefore reduce exposure. So I would hope that those efforts that we've made at improving the building codes in the county have also gone the distance in terms of reducing exposure and risk.
Yeah. Thank you, Jim.
Mhm.
Very good. Any other questions for our staff? Well, and again, apologies for that change in venue. That was a unfortunate room scheduling snafu, as much as the weather wasn't, at least yesterday, conducive, but hopefully we'll get that ironed out so that we won't have the scheduling challenges. All right. That was the end of our new business. We have a fairly short agenda today, so this could go quickly. Joe, I think you are going to stand in and start with department updates.
Yes, thank you, Lane. Good afternoon, everybody. Yes, and as you say that, I think to myself, I've got a lot more to share than is typical when I address the board. So bear with me. As many of you know, Dr. Story is unable to attend today. She is celebrating a family event, so I will be filling in for her and speaking on her behalf. I gotta tell you, I couldn't be happier to support her while she is with her family. This is absolutely part of public health, and that is so that way we get away from public health sometimes and spend time with our families. So I couldn't be happier to fill in for her. She was wonderful enough to share some talking points and some highlights that she wanted me to share with the board. In particular, I know she's brought up some of the conversation around the moving out of the Parfait building for certain areas of the department to relocate to the Courts and Admin building. That conversation is continuing to move forward. We have a general layout that is much more appealing to public health than originally it looked when we were initiating these conversations. The initial floor plan would have been for public health to be more commingled with other areas of the county. It looks like we now have more of a dedicated space. Although we will be sharing some common area, it looks like public health will have our own entryway. We will have more identity in the courts and admin building. So that was a very pleasant surprise. I believe our partners at the county are working to support public health, and that we're not just one of the other areas within that very large building. So very exciting that public health will have some of our own dedicated space. Unfortunately, it looks like that timeline is a little bit more delayed than originally anticipated. It doesn't appear as though construction will start until later in the early summer. So the move is more focused on August, September, later in the fiscal year versus the quick boxing up of our stuff and moving in the next couple months. So we've got a little bit more time at the Parfait building. As Dr. Story has already mentioned, the clinic will not be moving to the courts and admin building as some of the other areas. I'm sure she'd like to share some more details as they become more available. But we are moving in the direction of relocating to the courts and admin building, and it is indeed very exciting for us all. Dr. Story also wanted me to mention the Emory relocation for the clinic and some areas, other areas of the of Jeffco Public Health. That conversation is still moving along. She does have a strategic meeting along with Max and other leadership team members of Inner City Health and JCMH, and the design group is digging deep into how the clinic will indeed be settled in that space that's currently allocated for public health. So there's a lot that's moving for relocating and those conversations of partnership for public health. She has indeed mentioned that there will be a study session and briefing on this project, and she's hoping that that's going to be a little bit later in the spring, and she's going to be sharing more information with the board and hoping that there will be opportunities for the board members, Board of Health members to engage in those conversations. The next item I have is the all staff retreat. All staff retreat is currently scheduled for February 26th at the Arvada Center. A lot of credit to Lindsay as the, planning and finding a location for such a large group, turned out to be somewhat difficult. Lindsay was indeed able to secure the location at the Arvada Center. Board of Health is more than welcome to attend. Any and all board members are obviously very welcomed. As I recall from the last all-staff meeting, I believe, Lane, you were in attendance, and Sherry. It was very nice to see board members in attendance, to be able to meet staff members, and for staff members to meet the Board of Health. I believe that is something that our staff do appreciate. So any board members who are willing and able to attend, I do encourage you to show up. I think there was some amazing food last time. I'm hoping that the same is the case when we meet at the Arvada Center. So that is definitely one of the wonderful perks of the in-person meeting. Some more news to share. Dr. Story was named to the new Heading Home Interagency Advisory Board. This is leaders from multiple agencies coordinating to inform countywide strategy on eliminating homelessness. This group kicked off last week, and their plan is to meet quarterly. Dr. Story has mentioned that she does indeed intend to update the Board of Health regularly, as this is a item of grave concern, or item of great concern for Jeffco and for our community members and partners. She is indeed planning to make sure she's sharing some of those updates with the Board of Health. Next is a very exciting item. Our Public Health Champions Awards is coming up, and currently our nominations open. The awards are open for nominations. So sorry. If you aren't familiar with this, there's a refresher that comes out every year. And Dr. Story wanted me to mention that this is indeed something that we hold every year to honor individuals and organizations in Jefferson County that don't always officially become part of that recognition. And we want to make sure that we are bringing forth those partners that really deserve some of that recognition and a space to really be brought to everyone's attention on all the wonderful work that they are doing. Past winners have included social workers, organizations tackling food insecurity, housing, family support, and many other great efforts in Jefferson County. Each awardee will be honored at the Public Health Champions event in April during the National Public Health Week, and will be featured in a documentary style video highlighting their work. That is indeed part of that reception, as many of you are aware. We all are provided with some really wonderful, impactful moments and highlights on the wonderful efforts that these community partners are involved in. So definitely a great opportunity for everyone. To nominate an individual or an organization, I wanted to go through some of that criteria because, again, the nominations are indeed open for this event. I wanted to emphasize that to receive a nomination, the individual organization unfortunately cannot be a JCPH employee, which means that they cannot be on payroll, they can't be part of the organization. Unfortunately, they cannot have received an award in the last 3 years. We are trying to avoid some of that recurring pattern, ensuring that there's not a dynasty that is being created here. So there's a tremendous amount of wonderful organizations. So in order to make sure that short list really comes to the forefront, we're making sure that we don't have some of those recurring agencies or individuals. So can't receive an award within the last 3 years. Although there is a requirement that they impact Jeffco residents, that net can be cast as wide as possible. So it's essentially Jeffco plus. As long as they are touching Jeffco residents, they can be nominated. And of course, are actively engaging in work that moves public health forward. So has to be associated with public health to some extent. If you have anyone or any organization that comes to mind, please reach out to Lindsay. She can make sure that that the nomination form is available to board members, and any other information can be shared. If you have questions, Lindsay, I'm sure will do a much better job answering your questions than I could. Now, unless there's any questions, I have a couple admin updates I'd like to add to the list. So I'll jump in. If there's questions, please feel free to interrupt. The first item I had, usually as we move into a new fiscal year, there is a little bit of a delay with releasing or revisiting the annual budget. So for 2025, the pattern or the routine is for the Board of Health to see the 2025 budget, and most of staff as well, unless there's a specific request, to see the budget when the January financials are released, which will be sometime in February. However, I wanted to mention primarily because there's been a lot of conversation with budget cuts and reduction of staff and many of kind of the negative aspects of the budget process. I do want to reassure the board that our 2025 budget is not too far off from our 2024 budget. Now, a lot went into the process. There's a lot that's packed into the 2025 budget. I just want to let you know that that ceiling, that marker, that target has not moved significantly. The reason for many of the discussions that were associated with the 2025 budget is because costs significantly increased. And rightfully so. Public health, as many of us know, has always lagged the market for especially salaries. In order for us to kind of move closer and shrink that gap a little bit, we had to incur a significant amount of costs to align better with the market. I will say that our partners at the county went through a tremendous ordeal to readjust a lot of our pay scales. And that was a heavy lift, but that really kind of brought us a little bit closer to where we should be for public health salaries and salary ranges. So I believe we're positioned in a great place to bring in new staff members as we identify the needs of our department and resources that are necessary to move us forward. I think we'll be in a much better place and positioned very well to continue to be that workplace of choice. But of course, it was a big struggle to get to this place. So I just wanted to mention to the board that the ceiling hasn't moved significantly. There's not going to be a big significant decline from where our budget was from in 2024 to 2025. With that, I have some unfortunate news to share, and that is that our health IT team has an additional vacancy. So our team is a little bit more lean than I had expected it to be at this time. That unfortunately was an unplanned vacancy, but it is something that I am grateful that we have a strong team that has shown a tremendous amount of leadership in this time of change and is continuing to support the department and available to support the Board of Health with our IT needs. Those two individuals primarily those individuals are Georgia Archuleta and Sarah Arensman, which I believe Board of Health has met during our previous in-person meetings. But again, I do not anticipate a reduction of service, but of course appreciate everybody's patience in this process. Unless there's any questions, I'd like to turn it over to, I believe, Christine is next on the list. Sarah, if you have a question for me, I'm happy to help.
I have a very detailed two questions. One, I believe last year, and this could be something that Dr. Story can let us know when she is back in the office. But I believe last year there with the all staff retreat meeting, she had given us like, here's would be some great times for the Board of Health to come, lunchtime or whatever, and maybe not the whole time. So it'd be great to know if there are certain times when it'd be ideal for Board of Health members to be there, if not for the full day. I know a full day thing is not really realistic for me, but I think a half day or a portion of the day could be without being overly disruptive. That would be helpful to me for some clarity on that. I don't know if anybody else agrees, but I remember that from last year.
If I could share really quick, Sarah, before you move on to the next question. Yes, I believe the agenda is still being developed at this point.
Okay.
It will be a very engaging, my understanding, a very engaging agenda. So I don't want to speak on Dr. Story's behalf, but I'm sure she'd be more than happy to share when it becomes as soon as it becomes available. But I will pass that along to her.
And Dr. Story and I did have some conversations. I think the morning, if you're already starting to try to block out some time when the initial introductions and kind of opportunities to share and meet would be great, especially if you can be there maybe even a little early so that there's an opportunity to kind of mingle with staff too. But yeah, I think any time though that any board members are available would still be appreciated. So do your best to match your schedules, but once the agenda is finalized, we'll make sure to share that with everyone.
Thank you, Lane. Sorry, I should have given you a moment.
And then my second comment was actually answered as we were talking, and we got an invite to the Champs Award on our calendars. So never mind. Thank you. As we were talking.
And a big plug for that. Honestly, for all the staff, I don't know if that is truly available to all GCPH staff to hear, but it definitely to see the videos at the very least. It's, to me, every year, it's one of those events that's incredibly inspirational, makes me feel great about working in public health. And it's just awesome to see the collaborations that our agency has made with the community and leveraging their efforts to further help those in our community. So fantastic event. Definitely please plan to join that if you're available. Any other questions? Otherwise, we can move through the rest of the director's team.
Yeah, Kelly, would you mind sharing the slides? And I believe Christine is next with her updates, if she has them. Thank you, Kelly.
It was mostly to keep me on track. Good afternoon. Just a couple of updates from the collection of programs that is epidemiology and strategic initiatives, along with emergency preparedness and medical records.
Christine, your audio is really low. I'm not
Yeah.
sure if that's.
Yeah, I can't hear you very well.
I was just trying to unmute to say that. It's similar to that. Lindsay had that same problem at the beginning, so I don't know, or maybe maybe not the same problem, same result.
Go and see if that helps. All right, any better?
Not really.
I got a new computer. Oh, Lindsay said open the laptop. All right, now I'm talking and all my windows are everywhere. Is this any better?
It's a little bit better, but
All right, well, I will yell in my office. If you can't hear me, just raise your hands, Lane, because I can see you on my screen. Couple of quick updates. One, you should have received our most recent infectious disease epi update placemat. Feel free to laminate and use it for dinner table conversation. The team has highlighted a summary of our 2024 year in review statistics, as well as the start of our 2025 tracking. As you can see, for hospitalized influenza, we are already above our 5-year baseline. That being said, respiratory disease infections are on track to be similar and peak at a similar time to previous years. We are hoping that influenza hospitalization number will level out leading into the middle of February, which is about when we expect to see our spike. Also on the placemat, you will see a summary of COVID case counts. I do want to point out that we are going to stop reporting individual COVID case counts because they are no longer required to be reported. So the data and the information will not line up for those that are asking about slides. We have no slides. The Board of Health has this in their inbox, so hopefully it helps them. The individual COVID case count numbers we will not be reporting anymore because they are not required to be reported. There was an update to the State Board of Health rules and regulations, and individual cases of COVID-19 are no longer required to be reported. Therefore, the numbers and the comparison and the ability to compare that data will be challenging at best. And so while we are continuing to do the work with COVID-19 outbreaks and helping our long-term care facilities manage infection within their locales, we are not going to be sharing that data any further on this epi placemat. You will also see a full year summary of our outbreak data, outbreaks that were managed by the infectious disease epi program. I do want to point out, when you look at this data, of the 489 confirmed, suspected, watched, or what you will see is not an outbreak, 41% of that 489 became not an outbreak because our community reached out to the team and received public health recommendations, and they adopted public health measures preventing outbreaks from developing. And I think that is a really, really good number and a really good highlight of what that team does in collaboration with the EPI team from environmental health. And I know Jim will have an update on their outbreak response as well. Also, I want to share that we launched this morning our first strategic initiative. As a reminder, strategic initiatives are those efforts, projects, initiatives that are directed by Dr. Story, our executive director, to be tackled as an agency-wide initiative. And so our first one launched this morning with a big goal of syphilis elimination. And we have a few key areas or lines of effort, if you want to call it that we have identified that will be working together as subject matter experts to tackle this large effort for the county. Sexual health, communications, provider education, health equity, really big work within the data science and infectious disease epi team. We have a policy line of effort and then a mental health line of effort as well. Our provider education lead, Lucy Funk, is already off and running. She had a meeting with Stride today and was able to share out some information. So we're super excited that we hit the ground today and are already impacting information and our county as we speak. So more to come. This is a long-term effort, but we wanted to let you know that the first one is off and running. And if you want an update at any time, definitely reach out to me. And with that, I will turn it over to Kelly, I believe, as the next slide.
Thanks, Christine. Any questions for Christine before she hops off? I don't know if you have the answer, but I'm just curious why COVID-19 is no longer a reportable disease. Just looking at the burden of disease on the placemat, 20 times the cases of influenza for COVID cases compared to influenza cases. So just interesting that that is something we're not going to track as a burden of disease and continue to track many diseases that have much lower amounts of cases, at least.
Yeah, I would say the simple answer to that is they're moving to severity of disease versus tracking the individual cases of disease. So we're still looking at outbreaks where there's large disease burden, and we're still looking at hospitalized cases of COVID-19.
Thank
And
you.
Christine, I just have a quick question for you. We probably are, but I just wanted to verify, are our clinics offering Doxy-PEP as prophylactic treatment for folks?
Max gave us an update today, and they just did their first point of care treatment. I think Max has a better name. It's more appropriate. I'm scanning the notes as I look, but yeah, they are off and running with the ability to provide the treatment. One of the challenges, to be honest, is getting the data in a timely fashion from CDPHE. And on that note, I do have a meeting with a larger work group at CDPHE next Thursday with some pretty tough questions and asks for them. So I will report back on that next time we meet, I'm sure, as well.
Yeah, I'd love to hear about if we're doing Doxy-PEP and what the uptake is as far as with our clients and whatnot. So that'd be an awesome thing to hear about at some point, Christine. Thank you so much.
Yeah.
Harriet, you're muted.
Sorry, I muted because I was coughing and then I forgot to unmute. Some of us aren't public health professionals in the clinical sense and don't know what Doxy-PEP is.
So Doxy is an antibiotic and PEP is post-exposure prophylaxis. So for instance, if I get pertussis and you and I live together, you can take a medicine as well to help prevent you from developing symptoms from whatever that disease is. So you've been exposed, we'll get you the medication post-exposure with the end goal of reducing the burden of disease.
So you don't have to get sick first. Okay, good, thanks. So it's doxycycline, is that the medication?
Yes.
Okay,
yeah.
I was just on some of that.
And Harriet, to take that a step further, there's some providers who are prescribing Doxy-PEP for folks who are at high risk of exposure. So it kind of works like twofold, I guess is how I want to say that. So yeah, I'd be really interested to hear more about how our clinics are doing that. So yeah.
Okay, thanks.
No, I can move into my updates. It actually bridges fairly well because I wish there was PEP for one of the focuses we have with health communications right now. If you are personally impacted by norovirus, I'm sorry. A lot of folks are getting it right now.
So we are doing a little bit of a messaging push around this at the moment, just because it's particularly relevant, unfortunately, as households are getting sick. So I couldn't resist sharing some of our graphics, one of which I think just was finalized earlier today around raising some awareness around these germs, unfortunately, that make the rounds this time of year, norovirus being one of them that's really making the rounds. We are also continuing on the communication side of things to work through our campaign planning process, where we put some additional energy and focus into topics that we really want to bridge out and build harder on. So leaning into tax season around earned income tax credits and the child tax credit around our CHIP priority of economic freedom. We also have some of our anticipated campaigns coming up, Public Health Champs and National Public Health Week being one of those as well, and Radon that we do every year. We also just started what we're calling a reverse media pulse. So a lot of times things come up in the media world, topics come up that they want to cover, they reach out to us for interview requests or to get some additional details for whatever their coverage may be. In addition to doing that typical media response, we are also trying to proactively push out information in connection with our campaign planning and other relevant topics out to media proactively as well. I think we had over 80 media placements in total last year, which is the highest I think we've ever had, excluding peak COVID, because that's a little bit of a unicorn in terms of media metrics. So this is part of our strategy to diversify and build out our relationship with our media partners so that we are available and connected with them in advance of different topics and needs coming up as they cover important health topics that reach our JEFCO audiences. And then briefly wanted to touch on legislative session on the policy side of my office. It started, it's a thing that's happening. Started a couple weeks ago. There are already a litany of bills that have been introduced, many of which we anticipate will come as well as our legislators work to get their different proposed legislation going and active in the session. We'll do a deeper dive into legislative session, different bills that have come up, strategy around them, or the details at your working session in February. We got some great feedback so far from Lane. Would love additional feedback from our board members too, as we work to plan for that and be ready to cover that in a way that's meaningful to the board. And so I can make sure that we've got all those pieces pulled together for you all. And then briefly, before I hand it off to Alex, wanted to acknowledge that we do have a new federal administration that has caused a lot of discourse at the national level. It seems that they have really hit the ground running, and there will be, I think, continued conversation about the different actions they are and aren't taking. Those are things that we will definitely be keeping an eye on. And also just wanted to point out too that those changes, I think, are going to have kind of a bit of a chaotic cadence in terms of how they trickle down and affect or not affect us. They may propose and enact different policy solutions. There may and will likely be different court challenges to some of those along the way, depending on the different components of what they are looking to introduce. So how that actually comes down and affects us at the local level, I think, remains to be seen. And there's a lot to play out after different policies are enacted or adopted at the federal level before it comes down to affect us directly, the work we do, or the great folks that are employed at JCPH. So wanted to share that we're aware of those things happening at the federal level, keeping an eye on it, and working to be ready in case there are impacts at the local level, but also to caution to following some of that federal discourse and knowing that some of that is going to take some time to play out in different ways. And with that, I would love to take any questions before I hand it over to Alex for her updates.
Kelly, I have a question. Hi. Last year you did, I'm sure this, I feel like you breezed past the legislative session, but last year you did like a place where we could like check on what bills you all are following. Are you doing that again this year? And will you, I'm guessing you'll just present it to us in February, but are you already doing that? And is there a way for us to look at what you're doing already?
Yes, we are doing that. So we are continuing to use the bill tracking software that we adopted last year. We are making some tweaks to kind of the internal process around like how our subject matter experts are reviewing bills as they come in. A lot is being introduced right now, so we're still doing quite a bit of sifting while that comes in, and we wait to see kind of how the calendar plays out. But you will, as a board, still have a link to see kind of the priority bills that we are tracking. Between now and our February meeting, I can make sure that that is tidied up and ready for y'all to see as we finish through kind of the initial sift of everything. But yes, we will still continue to use that tool, and we'll cover that more in depth when we meet in February.
Okay, great. Thank you.
And Alex, do you have an update for us?
Yes, I do.
Just checking.
Thanks, Joe. Good evening, all. Kelly gave a quick sneak peek on what I'm going to talk about today, but I'm excited to share about the work we are doing in community health partnerships around tax credits. And this work is led by Mary Margaret Faust Bishop, who is our maternal child health system supervisor, and Cynthia Farrar, who is our regional health connector. And they are a dream team when it comes to this work. Tax credits support healthier Colorado children, families, and communities. Many Colorado families with children are eligible for the tax credits, providing them with extra income that can go towards the things they need most, like groceries, childcare, school supplies, clothing, or even a savings account or college fund. Last year, Colorado passed House Bill 24-1311, which was the Family Affordability Tax Credit Bill. And this is a new refundable Colorado state tax credit that partially fills the gap left by the discontinued expanded federal tax credit, which you might have heard as CTC. It is set to continue through 2033, and it uses Tabor funds. And Colorado parents and families can receive up to $3,200 for eligible children ages 5 and younger, and up to $2,400 for eligible children ages 6 to 16, with higher credit amounts for lower income levels. You must file a state tax return to be able to receive those credits. So we often hear when we talk about this work, why is public health involved and why is public health talking about this? Because we know that when Coloradans have the financial resources to meet their basic needs, individuals, parents, children, and communities thrive. And then after Social Security, refundable tax credits are the most impactful way of helping families out of poverty. Oftentimes, the people who miss out on tax credits are those who live on low incomes, where sometimes you don't need to file taxes. So part of this is building that awareness of file your taxes so you can get these credits. Speak a language other than English, are newcomers to the country, live in rural areas, and are a new parent or a new caregiver. As Kelly mentioned, this is in alignment with our CHIP priority of economic freedom, and we're in our second year promoting tax filing and credit uptake as an upstream evidence-informed strategy to improve health outcomes and increase health equity. So some of the goals that the team is focusing on for this year is they receive funding from Gary Community Ventures to engage in a collaborative partnership with Adams and Arapahoe counties to help families unlock the full potential of the Colorado Family Affordability Tax Credit. Those strategies include partnering with 4 to 5 community-based organizations to increase access to populations who miss out on credits, and to also expand volunteer income tax assistance satellite sites in Jeffco and Arapahoe. And we're partnering with Jeffco Head Start, and they will be hosting a Vitus site, I think for 5 Fridays, starting in February for their families and staff only. And we will be tracking that pilot to see what opportunities could exist for next year. Continuing to educate partners about the importance of tax credits and the Tabor refund and the resources available, and to promote free tax filing resources and messaging through our networks, focusing on non-filers and those who need assistance. So one of our asks for the Board of Health is that when we start to put messaging out through our different channels, that we would love it if the Board of Health would help to amplify that message and to share out how incredibly important it is for everyone to file their taxes. And with that, any questions?
Thank you, Alex.
Thanks.
I know Jim's got an update for us, but I'm not sure if Max is available or has anything for the board today.
I do not. So I'm still catching up a little bit. Just got back from some time off. I will give a couple quick updates on just a few things. As you saw from the success of our team capturing revenue through the services we offer, Nicole and the nursing team and our administrative team have just been doing a phenomenal job. I can't say that enough times during these calls. Also, we just hired for our nicotine replacement therapy program, so we will be building that out starting pretty much right now. We're one of only 2 of the programs in the state, along with Broomfield, so it's exciting to be able to offer that much needed therapy. We are also working on figuring out our nurse practitioner just took some extended time off. So figuring out how we are restructuring a little bit of our sexual health and family planning offerings in the short term, especially as we start off this syphilis work group together. We have a lot of good ideas and we have a lot of good folks coming together and some stopgaps, but that is something that we are working through as well. So if we don't have any major updates on that during this call, the next call, we will keep you posted if there are any changes to those programs. As well as with our Points West team, they're noticing some changes to outreach and what drug supply looks like in the community. So it's changing a little bit of our harm reduction efforts, but we have a lot of partners in the area that are coming together to figure out how we can best address that, as well as the housing crisis and some of our folks that are facing the weather, especially during homeless outreach, this terrible weather we've been seeing. So we have a lot of things that we're working on. Clinic's very busy right now, but it's busy with all good things and a lot of growth that's coming. So very exciting. Sorry, I didn't have a slide put together for you today. And thank you, Joe, for giving me a little space there.
That was a lot for a non-update. Welcome back, Max. Sorry to put you on the spot. I know you got a lot on your plate. Thank you for sharing. And I know Jim was on the list. I think we kind of got a little out of order. Jim, do you? And I'm so sorry if there were questions for Max. If not, Jim, I think you've got the floor.
Well, hello, everyone. I'm glad the meeting is scheduled till 6 because I'm going to surpass Joe's 20-minute presentation. No, just kidding. I do have a few things. It's been a while since I've shared much information about environmental health services with the board. But I wanted to start out, it's kind of connected to what Christine and Kelly shared about norovirus and foodborne illness in general. 2024, the Environmental Health Services Unit here at JCPH investigated 192 complaints about foodborne illness. Though the response to those complaints can range from anything from a phone call or conversation with the complainant and or the facility operator, usually when there's one case involved, not connected to any other cases that may have, or that no other cases have been reported connected to that establishment, to full-on outbreak investigations, teaming up with our friends in EPI and others around the county. It seems to be a trend that gastrointestinal illness in particular spikes in the fourth quarter of the year and first quarter of the new year. We're not immune to that, that's for sure. We've seen 5 outbreaks, documented outbreaks of gastrointestinal illness associated with facilities in the Jefferson County since October. During the holiday weeks of Thanksgiving, Christmas, and New Year's, our team faced 2 suspected GI outbreaks alongside a surge of foodborne and non-foodborne complaints that all required investigation. This influx of complaints created some significant challenges, as you can imagine, for the environmental health staff, primarily due to limited holiday working hours for both EHS and the retail food establishments. And despite these obstacles, our team the dedicated environmental health specialists from our team effectively triaged and prioritized the complaints for investigation. This process was driven by factors such as availability and ability to contact complainants, their willingness, of course, to participate in an investigation, and their cooperation in submitting the fun stool samples that we often need to collect in order to confirm illness. One outbreak that we investigated involved a norovirus-like scenario amongst the staff of a national chain restaurant over the Christmas and New Year's holiday. That ultimately it was confined to the staff, thank heavens, and did not spread out into the community, mostly because we believe the diligence of our inspectors, plus the effective company policies surrounding keeping ill employees from working while they're sick, as well as a strong response policy for cleaning and disinfection of the facility during the course of the suspected outbreak. The 5 outbreaks that we've investigated totaled up to almost 40 hours of staff time. That's environmental health services staff time at a cost of approximately $3,000. These are not inexpensive activities to conduct, as you probably know. However, the total EHS hours or the total hours that we spent don't include any time and effort spent by our retail food team in terms of their actual inspection work, the JCPH infectious disease team, who provide vital support to the environmental health services team during outbreak investigations. And we are very, very thankful for their partnership and their expert guidance as we work to try to figure out what's going on and work to try to control the spread of these diseases. On top of all of that, we had 2 new hires start at the end of December who both rocked it and jumped in and got some just-in-time training on how to do foodborne illness investigations. So it worked to their favor and to ours to have the new people actively engaged. You heard earlier this year, I believe, about an outbreak associated with a restaurant here in the county where several of the staff, they didn't have good policies in place to keep staff from working while they were sick, and ultimately resulted in some cases outside of the establishment. Well, that case has taken a national stage, and Jackie Johnson and Ursula Till from our team will be speaking, they've been invited to speak at the Integrated Foodborne Outbreak Response and Management, or INFORM, regional meeting in San Francisco next month to talk about this outbreak and hopefully learn or share the knowledge that they gained from the situation that happened here in Jefferson County. And I just wanted to brief the board on the process that we're going through in terms of 2025 license renewals for this year. As of this afternoon, we have, let me start over with this one. 2025 renewal notices were sent out on November 1st of 2024. That's almost 3 months ago. Last week and this week, our environmental health inspectors have hand-delivered 298 late notices. And the deadline for delivery of those notices was today. As of today, 151 licenses remain unpaid, and the deadline for payment is 2/3/25, February 3rd, 25. At that point, any outstanding unpaid licensees will receive another notice of violation, which goes with a civil penalty of $250. That will be generated on February 4th, and they will get 2 weeks to pay before the 3rd notice of violation, which will be, I believe, a $500 civil penalty. So we're really utilizing the regulations and statutes that we have in place to be able to ensure that folks obtain their valid and current retail food license, with the target of hopefully by the end of February, we'll be pretty much through that process and have all of our retail food establishments currently licensed. We have also provided our unpaid body art establishments. You may recall that as a local regulation that you all have adopted that requires all body art establishments in the county to be licensed. The deadline for payment, again, is February 3rd. We have 22 unpaid at this point out of some 90 plus body art facilities. So we're doing pretty well on recovering or relicensing those facilities. We've also sent out notification to all of our OWTS installers and cleaners that are licensed through the county. Of the 114 licensed installers, 24 are unpaid at this moment. And out of 16 licensed cleaners, only 3 are unpaid at the moment. So we're doing well, I believe, in getting folks up to speed. All the on-site wastewater treatment system cleaners and installers that do not renew their licenses by February 1st will automatically be inactivated, and they will not be allowed to operate in Jefferson County unless they obtain a new license from JCPH. I also wanted to let you all, or make you all aware of a bill that is being drafted as we speak. Newly elected Boulder and Gilpin County Representative Leslie Smith is working with Senator Dylan Roberts out of Eagle County, I believe, to draft a bill that would provide or create a low-income financial assistance program for replacement of on-site wastewater treatment systems. You all have had the experience of dealing with enforcement cases on homes or families that have been found it very difficult to replace or impossible to replace their on-site wastewater systems due to financial issues. So we're hoping, I've been working with Representative Smith since October on kind of giving ideas and input on what is needed, drafting a problem statement for her to work from. The bill currently in its form, it creates an enterprise at the state level. Sherry, I see your grin. And which would be funded through fees on permits. I'm not sure under the state of the state budget how that will work, but at least we have exposure to the issue, and that's really important. So as this bill progresses, we will get a copy to you to at least be aware of what it's all about. Certainly to direct any questions to me. Commissioner Delcamper is also involved. And we are also working with Lisa Witt, who's the public health director in Gilpin County. Lisa has a background in education, post-secondary education, and she is working with the School of Public Health to gather information, do some research on the need and other programs that exist across the country, try to help provide the representative with good information to be used in the further development of this bill as it moves forward. So I don't have a whole lot else to say at this point, other than I'm happy to share the most recent draft with you for information purposes only, because it's hard to tell the changes that may occur, but I do believe Representative Smith is intending to introduce this bill as a part of her bill package this year. A couple of just small or short announcements to provide to you today. I'm really proud of our radon team and our environmental health team We had some media work directly with Channel 7 and Univision to do stories on radon awareness. We did one in English and one in Spanish, which was very, I think, very well done. Kudos to the EHS team and the health comms team for the outreach opportunity to those communities. And on a personal note, I have received and accepted the position as the Colorado Directors of Environmental Health affiliate representative on the CALFO Board of Directors. So I will be working directly on the CALFO board for the next, believe our bylaws are 2-year term. And I've also received and accepted an appointment as Region 3 Vice President for the National Environmental Health Association. So I will be, I'm just beginning that effort. And right now there's a lot of learning to do on what the organization is up to. But that organization has progressed amazingly over the last several years and is doing some really great things at the national level to advance the environmental health profession, as well as to advance and advocate for environmental health initiatives across the country. So I'm very excited to be a part of it. And that's all I have for you, unless there's questions.
Jim, you're a rock star. I love that. Congratulations to you. You mentioned that draft of that bill. If you would share that just for informational purposes, I would love to see that. So thank you. And again, rock star, that's just great. Congratulations to you.
Thank you so much.
Very good news for Jefferson County. It means we probably got you for a couple more years, huh, Jim?
You never know. Both of those positions don't require employment.
Even CALFO?
Maybe.
Well, it's always a pleasure to see you highlighting the great work that your team is doing. Any other questions or accolades for Jim? Thank you so much, Jim.
You're welcome.
Does that round out department updates, Joe?
That is it. Yes. Thank you, Lane.
Awesome. Any staff wishing to make comments? Board of Health members, any comments?
I was slow when you asked for the accolades for Jim, but I want to echo the congratulations. I think it's very exciting, both on the state level with CALFO and also in a national organization. So that's kudos to you and thanks for everything you do, Jim.
Thank you, Harriet.
Sherry, go ahead.
I would say ditto to all of that everyone has already said. Jim, it's just a great pleasure to see you involved in all of these things. And we'll set up a time to actually sit down and chat with you about the couple of things coming through, like the bill that you're talking about, being an enterprise, et cetera. But I want to just thank the staff as always. I'm always impressed when we get these updates from the directors and the staff about the incredible things that you're doing. It's just it makes me just really proud to be in Jefferson County. You've all just done such a phenomenal job of getting out into the community and all the stuff that you're doing. So I just want to say thank you.
And I have the pleasure to also get to go to Inform, so I'm excited to hear the Jeffco folks present out there. So I have one presentation that I'm going to be doing myself. One of my last trips for Boulder County Public Health, and so I will probably be in a hotel room for our meeting, so I won't be able to join you in person for our study session with Kelly and staff, but I still am anticipating joining in for that. But I think hopefully I'll be landed and in the hotel room by the time we kick off.
One of your last hurrahs for your big retirement at the end of February?
Yes. So
It's coming up quick.
it is coming up really quick. It's pretty crazy how quick.
Are they gonna have Coach Prime there for you?
Yeah.
I don't know if he's going to make any guest appearance. I would doubt that, but maybe that'll be the surprise seller to get folks to come.
I'll give him a call.
Thank you.
All right.
And it's maybe his dog. Actually was there last year. We were just touring with some out of town guests, and all of a sudden I see somebody playing catch with their dog on the field. I was like, they allow dogs on the field? And they're like, they allow one dog on the field. Gunner and Coach Prime playing catch. Any other comments, board members? Well, thank you all. And again, apologies for the last minute changes, but hopefully we got everybody connected, and thanks for the fill-ins for the radon proclamation. And if there's no further business coming before the board, we can adjourn.
Lane, I have one quick question. Do we have an employee of the month luncheon this month? I did not get it on a calendar if we did. If we do.
We do not. Sherry will have one. We'll start that back up in February.
Okay. I just wanted to make sure that it wasn't me missing something.
Nope.
Thank you.
Bye, everyone.
Awesome. Thanks for that clarification. And with that, we'll adjourn, and everyone have a good evening.
Thank you.
Thank you.
Bye-bye.